Hello, my name is Dr. Nitiraj Oberoi. I am Director Orthopaedics Services at CK Birla Hospital at Punjabi Bagh. We shall be discussing shoulder pain today. The important thing to know is that pain in the shoulder always does not present at the shoulder, and pain in the shoulder always does not originate from the shoulder. So as a clinician, it becomes important for us to ask you questions and to look at other possibilities of a referred shoulder pain. We'll briefly talk about referred shoulder pain first. तो कंधे की वो दर्द जो कंधे से ना निकल के कहीं और से आ रही हो. It can come from your neck, from a pinched nerve. It can come from behind the neck, from what is known as scapular dyskinesia or trapezius syndrome, जो कि computer users में बहुत पाया जाता है. It can come from your stomach. If there is an inflammation in the stomach, it can come from your heart. It can also come from your chest, from your lungs, and from the cavity which is holding the lungs, known as the pleura. So there are so many features which can present pain in the vicinity of the shoulder. कंधे की दर्द हरदम कंधे पे नहीं होगी, कई बार हाथ के बीच में होगी, कई बार कंधे के पीछे होगी, और कई दफ़े वो सिर्फ कुछ मूवमेंट्स पे होगी. और आप सोचेंगे कि बाकी सब तो ठीक है, सिर्फ एक मूवमेंट करने में, कमीज पहनने में या पीछे से कोई बैग उठाने में मुझे दर्द हो रहा है. All these things need to be evaluated properly. So once you meet a surgeon, he'll ask you questions about the type of pain. Is it constant? Does it come and go on movement? Is it related to your sleep? Is it related to your work? And is it related with any other symptoms? Indigestion, fast heartbeat, sweating. He may also like to know how it started. कई बार हम लोगों की हैबिट से शुरू हो जाती है, किसी तरह से खास सोते हैं हाथ नीचे रख के, या फिर पतले तकिए लेते हैं, या फिर अपने आप को सपोर्ट करते हैं, या बैठते गलत हैं. And sometimes as a result of certain sports. So if you are a golfer, or if you are a tennis player, or if you are a cricketer who's got who fields more towards the periphery, so these can be, or you are a track and field athlete की throwing injuries हो जाती हैं shoulders के अंदर. So the common questions will be about pain, about stiffness, and about the feeling of instability. Instability का मतलब है कि आपको लगता है कि कुछ हरकतों में कंधा बाहर आ जाएगा. You're trying to throw something and you feel that the arm will pull the shoulder out. And this is something which needs to be seen carefully. There are certain areas in the shoulder which are more commonly involved. Now we will only talk about those symptoms which come from the shoulder, not from outside the shoulder. And one of them is called impingement. You'll hear about impingement a lot. Impingement का मतलब होता है कि वो मांसपेशियां, those muscles which are lying between the top of the shoulder and the ball of the shoulder. So the top of the shoulder and the ball of the shoulder are getting hit because of either an abnormal ball movement or an abnormal hook on the top of the shoulder. So this bone can either be abnormally placed or the ball could be riding higher. So this has to be differentiated and treated accordingly. Treatment usually involves X-rays, ultrasounds, dynamic ultrasounds, MRIs, and initially, unless there is a huge tear or basic injury, it involves physiotherapy of different types. Sometimes we may give injections. These injections can be given with or without ultrasound guidance, depends upon where we want to go. And then occasionally we may have to resort to surgery. Then the other thing which is very common in these days that we notice a lot ever since people have gone onto online working, long hours on laptops, abnormal sitting postures, kabhi bistar pe kaam kar rahe hain, kabhi. So these things have led to pain which comes to the front of the shoulder. There, the doctor has said, "Doc, the pain is right here in front of my shoulder, and when I try to do this, it's extremely painful." This usually comes from inflammation of the tendon of biceps. Biceps is the muscle in the front of the arm, and the tendon goes and attaches inside the shoulder, and this tendon of the biceps can, because of abnormal positioning, can give rise to inflammation. Again, the treatment pattern is the same. It will involve rest, ice, medication, physio, correction, occasionally injections, and then sometimes surgeries.